Employers and employees often ask whether they can use their HRA for Medicare premium reimbursement. You can use HRAs and Medicare together, but combining the two can get a little tricky. In this video, I'll break down how it all works by the different types of HRAs and Medicare plans. What types of Medicare are available? Before we talk about combining Medicare and HRA benefits, let's go over each type of Medicare plan in more detail. Medicare Part A is hospital insurance. It's considered minimum essential coverage by the Affordable Care Act. Medicare Part B is medical insurance, covering any medically necessary supplies or services and preventive care. Medicare Part C, also known as Medicare Advantage, is a health plan offered through a private insurance company that has a contract with Medicare. And Medicare Part D is prescription drug coverage. How does Medicare work with the QSEHRA? The Qualified Small Employer HRA is one way employers can reimburse Medicare premiums. A QSEHRA is for employers with fewer than 50 full-time equivalent employees. The QSEHRA works with Medicare Part A if your employees are enrolled in Medicare voluntarily. If Social Security automatically enrolls them, the IRS doesn't consider it a medical expense. The QSEHRA works with Medicare Part B if it's combined with Parts A or C. The QSEHRA works with Medicare Part C. The QSEHRA also works with Medicare Part D if your employees are covered by MEC. How does Medicare work with the ICHRA? With the individual coverage HRA, eligible employees and their dependents must have a qualifying individual health insurance policy in order to participate. The ICHRA works with Medicare Part A if your employees are enrolled voluntarily, just like with the QSEHRA. The ICHRA works with Medicare Part B if it's combined with Part A. The ICHRA also works with Medicare Part C. The ICHRA doesn't work with Medicare Part D. How does Medicare work with the GCHRA or the EBHRA? This one's quick. The group coverage HRA and the accepted benefit HRA are the only types of HRAs that don't work with Medicare insurance plans. Since Medicare is an individual insurance option, and the GCHRA and the EBHRA only work with a traditional group health plan, the two aren't compatible. If your employees use a Medicare plan, the QSEHRA or the ICHRA are your go-to HRAs to work with their health insurance coverage. To learn more, you can read our article on this topic. We've provided a link to it in the description. If you're an employer looking to provide employee benefits, PeopleKeep can help. Our personalized benefits administration platform makes it easy to set up and manage HRAs in just minutes each month. If you found this video helpful, be sure to give us a like and subscribe to our channel for more employee benefits and small business tips. Thanks for watching.